Hi, my name's Nicola Chicken. I'm a project manager at the Yorkshire and Humber Academic Health Science Network, or AHSN. This short video is going to talk you through the structure of a series of resources that we are going to be releasing over the coming months on the subjects of remote monitoring and virtual wards. So first of all, I'd just like to give you a little bit of background. So in Yorkshire and Humber at the AHSN, we've worked intensively over the last 2 years with colleagues across our 3 ICBs, with NHS partners and innovators to bring new and enhanced virtual wards and remote monitoring technologies to the region as commissioned by NHSX. It was initiated as a rapid response to COVID-19 and this quickly evolved into a spread and adoption piece, piloting 3 innovations across a wide variety of patient cohorts and pathways in primary care, acute trusts, hospitals, emergency departments and the care sector. As you can see from the graphics on this screen, it just demonstrates some of the wide-ranging benefits of remote monitoring and virtual wards, with an overview of the benefits that we saw for patients and their families, staff and the wider system. Now, as you can imagine, this work provided us with so many great opportunities for learning about remote monitoring and virtual wards, the benefits they could provide, as you can see here, the common challenges and risks, how best to approach implementation and how to ensure sustainability for the future. We're really keen to share this learning with our colleagues in the ICBs to support them with their upcoming ambitions around virtual wards and remote monitoring. In the coming months, we plan to release a series of resources providing our lessons that we've learned and top tips. Our aim is for these to be a really useful, practical series of resources for project teams in the ICBs when it comes to implementing remote monitoring and virtual wards. And we're aiming for these to cover a wide range of formats, including videos, audio, succinct written guides, and social media content. Our aim for these resources isn't that they are a really granular level, kind of step-by-step how-to for every element of implementation. They're more kind of practical lessons learned and top tips from our experiences over the last 2 years. There are loads of great resources out there covering the lower level detail, and we'll be collating links to all of these great resources into one place so that we can signpost you to those. In order to give our series of resources a good structure, we have come up with what we're calling an implementation wheel. This covers what we found were the main 5 stages of implementing virtual wards and remote monitoring, and I'm going to talk you through those now. The first in the series is Start. So this is at the beginning of your programme, and this covers things that are important to do at the very start of your programme to set yourself up for success by ensuring the scope is clearly defined, you've identified pathways and services, and you have defined your objectives. The next stage is Engage. So this is all about engaging the correct stakeholders, setting up for success, including procurement, workforce, and all of the requirements that are needed to implement technology into a service. Next up is Deliver. So this covers things such as training, system and tech setup, and comms. So this is the stage that is really making sure that you've got things set up for when you go live. Embed is the next stage. So at this point you will have gone live, and this covers post go live support, activity and outcome measuring, and continuous review of the project. And finally, we have Sustain. So Sustain is all about reviewing and evaluating and ensuring sustainability for business as usual. It's important to bear in mind that each stage of this wheel is interconnected, and it will likely be necessary that you'll need to move back and forth through each stage throughout the lifetime of your project. For example, it may be that once you've moved past the start stage, you may need to come back and revisit your initial business case, or there may be additional stakeholders that you need to engage with that hadn't been mapped at the start. Additionally, in terms of benefits, once you reach the embed stage and the service is live, it may be that you're finding additional benefits that you hadn't identified at the start or engage stages, and you may need to revisit your benefit plan and include those in it. Another key point is ensuring that you've got flexibility to adapt to change. So although it's important to have a really clear and defined plan at the start of the programme, as you move through the different stages, you may find that you need to adapt that to changing circumstances. And it's important that you consider that and reflect on that throughout the implementation process. It's really important to allow yourself sufficient planning time and to ensure that you've set up strong governance structures to support you throughout the process. As I mentioned previously, you may need to move back and forth between the different stages of this implementation wheel as you go through the project. So having that strong governance in place means that you can easily refer back to decisions that were made and the information that informed those decisions at the time. So as I mentioned, we're planning to release a series of resources that cover each of the stages of this implementation wheel. And the first is Start, which will be published alongside this video. The guide that we've created for Start focuses on creating and building your initial business case and the digital solution Moscow Matrix. The series of resources will be published on our website, which is www.yhahsn.org.uk, and please ensure that you're also following our YHAHSN social media channels for updates. I hope you found this useful and are looking forward to the upcoming series of resources. If you do have any questions or feedback, please feel free to get in contact with me. My email address is nicola.chicken@yhahsn.com. Thank you for watching.